Hello, thank you. It's a health illness update. Good in the one in the beginning of January this year. It's now the end of January. I suppose this would be the biggest one since the very first one. I've sat here with Barely Bear, who's being cared for by Dr. Bear. For a while, I just trying to decide what kind of face or mood or starting comment to give, or if I wanted to complain about anything. And all these things running through my head. I'm sitting here with my chai, recovering. I had a trip up to the Boston area yesterday for a wonderful group there, and got to share some high energy Sing Chuan, but personally speaking, it really takes it out of me. That's a long drive both there and back, plus it was kind of dark and rainy on the way back. It was still worth it, but today's kind of a full recovery day. Last Thursday, I had a long day, working here at the farm and with students, and so again, that kind of knocked me out Friday, which was a long teaching day anyway. So I'm very tired. I guess symptomatically, sharing the symptoms with you that you might be willing to hear about. I still don't have the same taste I used to have, but if I'm able to live with it. I still have the peripheral neuropathies, but again, I can manage that. It's that's all right. And my blood sugar hasn't been great, but it hasn't been, deeply worrisome or anything, and it's trending in the right direction. And that gives some pause to the surgeon who knows that, having a out of value, out of range blood sugar makes healing harder, or, less good outcomes, or I'm not sure if he said harder or longer. I think he said that the healing is less good, So anyway, I'm working on that. So Monday, that's wrong. Wednesday, so a couple days ago, today's Sunday, I had a meeting with my medical oncologist, and my understanding is that she's sort of the orchestral conductor of this whole care situation I'm in. I also have, my GP and his APRN, so they kind of feel like they're up there in terms of seeing the larger picture. I'm not really sure. But at any rate, I saw her. I had, the last update I gave, I was talking about how my ctDNA test wasn't covered, and this next one I would expect also wouldn't be covered, but I went ahead and had that done, I think soon after I did the update. And I didn't get the results on it before I could talk to the medical oncologist. In fact, before my appointment with her, I told you, really tired. I reached out to the office and I said, look, I was told by the testing company, which is called Signatera, I was told by them that it's a 50-50 whether or not I'd get results in time to have my oncologist see them, for my meeting. Anyway, the oncologist's office, Dr. Stein, said that we'll just keep the appointment, and if we don't have the results, once we get the results, we can always call you back and say, okay, given the new results, here's the change in plan, or we're sticking to the plan, that kind of thing. So that was fine. One of the things I'm wrestling with is that in this last meeting really put kind of gave me the sharpest clarity on my preference, which is to find a different medical oncologist. But I don't know how to do that. I don't know I don't know how I go about, transferring or finding one or second opinion or how that goes. Just because the communication with her is problematic. I don't mean digitally or calling the office or anything, but like literally talking to her. And part of the concern I have is that, she seems to be quite expert, and maybe, allowing her to be expert and me not to feel as communicated with as I would like, and I indeed believe would be helpful, is a better use of my energies and trust rather than meeting my own wants, which feel like needs, but I don't know. So anyway, so I met with her. This was my first time meeting her as a telehealth thing. So we did that, and she just kind of jumped in with, here's what I'm thinking, here's where we're going, having read the results, which were bad for me. And kind of just like sort of zero bedside manner, zero outlining of the context of things for me before talking about what that means and what we're going to do. And it wasn't a case of her just sort of thinking I was up to date, just kind of how she communicates. Anyway, so I kind of registered that while I'm on this moving train of a conversation with her, and it moves fast. And so I'm taking it in, but unable to process it, which is really, a massive gut punch. So I had gone in for a CT scan. I'd done the ctDNA. I hadn't given blood before that. So I did give blood a couple days later, I think, Friday. I saw her Wednesday afternoon. Anyway, as soon as I got off the telehealth with her, it was time for me to teach. No processing. And then Thursday was a really, really crazy day. And again, no opportunity to process. And then Friday starts very early and a long day. And then I need to recover. And then I'm preparing Friday to go to my workshop on Saturday, which is a big deal to me. So again, couldn't really process, talk about it at home or write about it or think about it or whatever. Or film this, update, share the news. And then Saturday is a big long travel day. And today, I don't know what time it is. It's, let's say, a little bit after, 2 o'clock or something. Finally, sharing this, even though it's unprocessed. But anyway, so I had the CT scan. Now, you may remember, longtime listeners may remember that, early on when I got a CT scan, like very, very early on, and they said, well, okay, we see the tumors in the liver and so on and so forth, and we start chemo and make a plan for surgery and all that. They said, well, we see a couple things in the lungs, but they're very, very small. We'll keep an eye on them. By the way, a lot of people have things in the lungs. And were you ever a smoker? No, never, even like once, even a puff. And they said, well, people have things, and it doesn't mean it's anything bad, we'll keep an eye on it. And of course, through this whole process, I've had a bunch of CT scans. And, it's always been sort of like at the end of the report or at the end of the conversation is, and we saw I don't know if they call them lesions or inconsistencies or concerns, not concerns, but things in the lungs, but nothing's changed. My last 2 CT scans ago, so that would have been, a month or so, One of them they said had changed a little bit, like slightly bigger, but like very, very slight. And then I was told, well, uh, it's within the margin of error. We might be looking at the same thing, but in this particular angle or whatever, it just looks a little bit different because of the resolution. And so anyway, but we'll keep monitoring it. But again, it may be nothing. I guess generally in medicine, like if you look deeply enough, you're going to see things that cause you concern. But that's different than something that's symptomatic or problematic. And I have no symptoms from the lung thing. So anyway, I'm on the call with Dr. Stein, the medical oncologist, and she basically is saying, well, given that this is now, she's looking at the most recent CT scan and saying there's further growth. She's like, well, it's safest to assume that that's the cancer metastasized from where it been, and then she's just continuing on with the conversation. And I'm like, wait, did what? So I'm thinking, like, does that mean I have lung cancer? Does that mean the colon cancer is metastasized? Does that mean we just don't know, can't know, or don't need to know? I don't know. So I kind of tried to I tried to wrestle the conversation in a direction that would help me get some clarity on this. And what I gathered is, and this is very early, I know it's a couple days ago, but really like no chance to process it. Is that she said, paraphrasing in essence, barely, Bear, you were there. She said that it looks too small to be a good surgical candidate. And she said if they go in there to try and get it, and I think she was thinking biopsy rather than like resection, but maybe they're kind of one and the same. When it's small, they try and get it all out and then biopsy. I'm not really sure. I think of a biopsy as like taking like a core sample, taking some of the thing. And she said I think she said there's a quote, a good chance that they'll miss it, which I understood to mean because of its size, but it might also have to do with like its position or something, right? And of course, she's not a surgeon. She's not a lung doctor. I don't think she's even like a upper chest kind of doctor. She's in the lower GI kind of thing. That's not to say I don't really appreciate her opinion, but that was kind of my take. And so she suggested that going in to get it isn't likely to be the answer. And then she said, look, if something's changing, it's probably not good, right? So seeing the growth trending in this way is probably not changing. So I tried to talk to her about like, well, we were tracking its state, right? Or their state, the I don't know what they're called, the nodules or whatever. We've been tracking their state, and somewhere in there I was having chemo. And so, did the chemo make them smaller? Did it slow their rate of growth? And so kind of looking at that timeline, she kind of looked at it and she can see it more clearly and understand it and interpret it better than I. And she was like, it looks like, if the chemo had done something, we would have given the chemo credit, but it might not have been doing anything. It might not have been growing. So we just really can't say. And I said, well, so what do you think happens with this? She's like, well, I think, chemo may be the answer. And then she said to me, what do I think? I don't know what I think yet. There's literally 2.5 minutes ago, I learned, I have cancer in the lungs. Or I learned that it's wisest to presume that given the data at hand, that I have cancer in the lungs. And the question now is, how to get more data and how to treat it. So staying with the chemo part, because we went somewhere else for a minute, she said, if we go back to chemo for this, it would be a different cocktail. It would be, I think she said, less chemo, less drugs in the cocktail, which I've previously learned would mean less of a time in the chemo treatment sessions, right? I think my previous ones were like 5.5 hours or something like that. I don't know how much less. And maybe I'd be lucky, and the drugs that I wouldn't be involved in this coming course, if that is the path we take, maybe the ones that we take out of the cocktail this time are the ones that gave me the most difficulties in terms of ongoing symptoms, or damage. That would be nice, right? But I don't know. So she said, I think she said it, what do you think about radiation? I think that's what she said. And I noted immediately, just mentally, that this is the very first time since the I think the first time I heard the word cancer was when I was at the getting the colonoscopy when I came out of the propofol. That was the first time I heard that word from anybody. I think before that, my APRN, Cassie Cotter, I think she was considering all the conditions and sent me for that colonoscopy and said, we want to rule anything out, so that's why you're going. But she didn't say, we want to rule out cancer. Anyway, that was the first time I heard cancer. And then I'm thinking, all I know is that the chemo and radiation, that, those are like the things that happen apart from surgery, And I was like, I don't know what this means. I don't know even what radiation, but it never came up at all. So I'm just presuming that I'm just not a candidate for it, or this type of, I'm just going that route instead of this route. That's fine. And in this case, she said, what do you think about radiation? I said, I don't know. So we talked about it a little bit. And I said, what I'd like to do is see an interventional radiologist, or maybe that's the wrong term. Maybe it's a radiation oncologist is my guess, because she's a medical oncologist, meaning chemotherapy oncologist or systemic oncologist, rather than a targeted oncology protocol such as radiation. So at any rate, I said, I'd like to be referred to somebody that would do that, to get an assessment from them about, what are the pros and cons? Because the chemo side, they know that, and they might have a stronger case for doing their thing. You might have a stronger case for doing your thing. And it certainly might be radiation followed by chemo, or do chemo and track it. And if it doesn't, something like that. But I thought, well, why don't we just do that? So I'm assuming that I've been referred to somebody, and I'll hear from somebody, and that'll be one of the next steps. I'm also thinking that when I saw Dr. Duffy recently, the plan was, you can't see my hands, but I'm going down to the navel here, is to open me back up and reclose everything where the herniations are going. And I didn't read the CT scan comparatively to the last one, because he wanted to see over the course of the last 2 CT scans any progression or worsening of the herniations that are, starting where I had been closed up, as well as in the stoma site. But anyway, I'm thinking, well, hey, I don't know if he's opening me up that much. I don't know, where does the scar start? Yeah, I guess it starts just, just under the breast. I said, maybe when they open me up, I said to myself, maybe when they open me up, they go and get the lung stuff too. I don't know. I would think that they wouldn't want to sew me all back up nicely and then go back in. That always strikes me like when you see a nicely newly paved street, happens every 20, 30 years in your neighborhood. And then like 2 weeks later, the phone company digs up little bits and patches it, or the water company does the same. And you're like, we just got this nice. Why are you digging? Couldn't you have done this 3 weeks ago? And you have like 18 hours of a really beautiful, smooth, wonderful street, and then the workers go in to dig stuff up. Maybe it's nicer for them to dig where it's nice and clean and new. I don't know. Anyway, that was part of my thinking. I'm sure that's not a big concern, and they'll figure it out. And maybe that means, again, 2 surgeons go in there at once and do their job. I don't really know. Okay, so that was Wednesday. Okay, so then I went in and I gave blood, because my oncologist wanted the blood. Normally I go in and I get blood right before I see her, and somehow they get the results when you see her, an hour later. And they didn't schedule it this time. I think it was an oversight, actually. But anyway, I went in, luckily at my own doctor's office in Westbrook, gave blood, and again, Dawn was there doing the phlebotomy, and she's just the best, and she took care of Barely Bear, gave him a new bandage on his ear. And they show everybody. There's the new bandage you got from Dawn, who was very, very sweet. As soon as I came in, she's like, how's Barely Bear? Anyway, they took blood. I had texted to make sure that they got an A1C in the blood request. That's the blood sugar. I figure I'm going in. We might as well get it. And luckily, there was no pushback, so they did that. And then they checked. I also had asked to make sure, I'd asked Dr. Stein to make sure that we checked my iron and vitamin B, to get a panel for that, because those had been low, and I've been on supplements for them, which seem to be working. I've since seen the results, and they appear normal to me, but I don't want to be on the iron sort of forever. And nobody's answered my question about if I can take slow release iron, and nobody's answered my question about when I might get off the iron, and most importantly, nobody's answered my questions in terms of, why might these vitamins and minerals be challenged? What am I missing? And I remember asking Dr. Billingsley that, because the liver plays some role there in terms of the iron, and didn't get any satisfaction there. I think he tried to address it, but I don't think it's for him to answer. So I tried asking Dr. Stein, who's essentially a hematologist by way of medical oncology, but that was another part of just can't really get my sort of thoughts heard and addressed very well. So I don't know where I am on that. We also found that there had been an old request for like an allergen panel, maybe that's what it's called, from my pulmonologist, Dr. Corwin, who has now left the practice, but we did that blood draw anyway, and maybe we'll learn something from that. I don't really know. But apparently that was in the system from a long time ago, and nobody ever saw it. But then nobody ever followed up and said, hey, we've been expecting this, so I don't know. And the main thing, I think, was to get the, CBC and the CEA, which CEA is I forgot what it stands for, but it's sort of a sort of standard blood work method for detecting cancer in the system. But it's not nearly as fine-tooth a comb as the ctDNA from Natera. So anyway, I still haven't gotten those results from Natera. Every time I've had trouble getting them, and I've asked people to make sure I got them. I even asked Dr. Skine to make sure I got them. I still haven't gotten them, but I did hear from her in passing that they, I don't know how to say it, but they showed cancer. So they aren't negative. They are not negative results. So then the Natera test is positive, but I don't know like how positive or what amount, but they detected some. that also goes to argue that the Natera test is really looking for signature of my tumor, like, the specific uh, fingerprint of my tumor. And if that showed positive, then that kind of argues that it's a metastases from my colon cancer up into the lungs. I'm sipping my chai. It's 3:13 right now, so I'm going to send a former student a message. Try and send him a message at 3:14. I just looked at my phone. It's 3:13, so I'll hit send in a moment to say happy pie time. Okay. So then Friday, late Friday, I had to see the pulmonologist. I was really looking forward to this one because, as I mentioned, Dr. Corwin left the practice. Dr. Imevbore remains in the practice, and I hadn't seen him. Now, the reason I was so excited about it is that when I was in the hospital, and I had seen, 300 medical professionals parading in and out of my room. And the one that stands out as like the highlight for me was when Dr. Imabori popped in, and he said he was a colleague of Dr. Corwin, my pulmonologist, and she wasn't available or in town, or he was in town or something, and he thought he'd check on me. I wasn't having any pulmonary issues. I wasn't having any breathing troubles. I had been CAT scanned and MRI'd to death. And, I don't remember at which point that happened, if it was before the emergency surgery or after, but it's sort of a hazy daisy thing. But anyway, I remember him coming in, and I remember where he stood against the window. I remember his voice. I remember it was dark in the room finally. And I'm telling you, it's just the best bedside manner. I don't think he really did anything kind of interventionally, medically to help me. He didn't need to be there, in my estimation. And he could have sort of been in and out real quick, looked at my chart, said hello, maybe listened to my lungs, and left, and gotten $400 or whatever it is, however that works. But he didn't examine me. We just chatted. And we got to talking about asthma, which is not a condition I suffer from. But he stayed, I'm going to guess, for 10 or 15 minutes. And he gave me an education on it. And I was lying in the bed, being a student, in a nice, pretty darkish room, dark, maybe, yeah. And he's got a really mellifluous voice and a wonderful presence. And he was, probably get emotional, but, he was probably not needed there, probably almost certainly needed elsewhere, where he could be more, his skills would be better applied. But for me, it was this window into some wonderful humanity. And it really reached me because I value being a student so much. And I didn't need an education on asthma, and I didn't have asthma, nor was anybody thinking I had asthma, but we got to talking about it, and he made it very clear, and he listened to my questions. Nothing about him seemed like in a rush to go. He's kind of, or maybe he seemed to be maybe leaning against kind of where the curtain and the window were. And and he found his way out, and I thanked him, and I really wanted to thank him for that. Since then, and as much as I like Dr. Corwin, when I found out she was leaving the practice, I asked what happens, and she said, well, you'll be shifted to Dr. Mabori. And I was like, not that I wanted to be done with you, but if I'm to be done with you, I can't believe my luck that I get him. So anyway, I was really looking forward to seeing him, and it was the longest wait I had had in a waiting room since this whole thing happened. It was a very, very, maybe 2 hours or 2 hours and 15 minutes, something like that. So it was quite the adventure. And I got to see him. I was his last patient of the day because I had let other people go in ahead of me who were definitely stressed about the wait. And he said, I asked the receptionist, who was definitely put upon by the challenges in the office that day. I said, I'll let everybody else go in front of me if you want. I'm a professionally patient person. It's no big deal. And they're obviously getting frustrated and all the rest. So I got bumped down the list a little bit. But anyway, I got to see him, and I got to shake his hand and like express some of what I just expressed now about how much his visit meant to me. But anyway, on to the actual medical part of it. So basically the reason I was there is I had this cough, which we think we've addressed with pantoprazole, this medicine. So basically he listened to my lungs and we chatted, and he looked at my medicine, and we were kind of like, all right, well, that's over. And then I said, we may want to talk about what else I just learned, 2 days ago is happening to my lungs and is about to happen to my lungs, meaning I assume they're going to get hit with chemo or radiation or biopsies or surgery or whatever. I'm standing here in front of this pulmonologist, and I thought, that sounds more like in your purview. And I could tell like it had been a really long day in that office. I don't know if somebody was sick or what, whatever happened. And I was the last patient, and the most of the lights in the waiting room had gone out, and and I thought, I want to ask him a few more things, and I want to convey this other, thanks and story to him. But I'm also aware, he probably really would like to get home. And I thought, well, I'll just ask him. I'll say, can I share a bit more with you? If you need to get going, I understand. And he was very relaxed, just like Dr. Billingsley would sit in the chair, very, very relaxed, which is really an extraordinary way to convey the body language. I had 3 experiences of that through this whole process that I remember now. So maybe I'll do a video about that. Somebody will have to remind me to do that. One was in Old Saybrook, one was in Guilford with Dr. Mavori, and the others in North Haven with Dr. Billingsley. But the body language in the chair being deeply meaningful. Anyway, he just said, I have nowhere better to be. So I said, well, the presumption here is that there's metastases in the lungs. So he cues up the CT scan. Well, I guess he already had it queued up. He had told me, he said, with every patient, I like to look at the scans, not read the reports. I want to see it for myself. And so it took him some time, but he did that. And then he was able to show me the things. First time I think I learned with any clarity, it's in the left lung. And he talked about where, I think, I don't remember the height, but it's on this side. And the other one is, I don't remember, lower than here, but on the midline, but in the back. Anyway, he looked at it and he said, yeah, it looks pretty easy to biopsy. Now, again, he's not the lung surgeon. I don't know that he does surgery. But that was completely different than I heard from Dr. Stein. I don't know who might be right. Maybe they're both right and different for different reasons. But he's like, oh, that's all they do is they go in here, which I think he meant sort of arthroscopically. And then I said, well, what about the other? And he went down. He said, yeah. Oh, well, that's also a good spot. It's in the back. It's it's harder when it's more medial to get to. And so he's like, yeah. And then he's like, by the way, colon cancer is like, I can't remember how he put it, but he's like, something to the effect of, we have our best outcomes with colon cancer. Like, just, it's fine. Like, so, I don't want to be putting my faith and hope and confidence in something like that. That's not what I do. But I don't think he was just trying to make me feel better. I think he was just being kind of just the facts, kind of like, just. So, he said basically we see our best success with colon cancer. So he didn't seem deeply concerned. He didn't change his body language. And he showed me where, and I could see the things. I don't have a sense of the size in terms of millimeters and the difference. I think it was 6 and now it's 9 millimeters, I think, but I just don't remember. And there's a couple of them in different dates. So I don't know. I know people seem to like that kind of thing. Okay. So what else? So he asked if I'd like to see him again. I said, definitely. So I'm going to see him again in 3 months. Who knows what I'll be in the middle of them, but I'm really glad to still be in his, circle. And he mentioned, he's like, if you go into the hospital again for this, if you have any breathing issues, call me or tell somebody to call me. I'll be there. Like, that was pretty nice, because I don't think I would have thought to do that. I think I would have just, I'm having a breathing problem. You guys pulled part of my lung out. I would have just said, what do I do and who's coming to see me? I wouldn't have thought to call him, I think. So I don't know. That was pretty nice. So the last thing I asked him, I said, look, if they're going to crack me open or irradiate me or chemo my lungs, or I guess, chemo the lungs, or biopsy me, I'm assuming that there's some kind of PT or recovery that you might do for that sort of thing. And I said, maybe you can direct me to how I can learn that stuff. I'll start doing it now so that I know how to do it. Thinking it might be some kind of breathing exercises or something, which of course I'd be professionally interested in it anyway. And he said, walking is the best thing. And I was like, well, all right, I got that solved. That's what I've been doing. And I told him that. So that was nice to hear. So I'm just looking at my notes: radiation, nodule growth, Signatera test results, walking for the lungs, chemo preferred. So the pulmonologist who I've just been talking about, I said, what do you think? I couched it in, I'm not looking for a recommendation from you on this because it might not be your expertise, but given your expertise, what do you think might more likely be where we lean in terms of addressing the nodules? And he said chemo rather than radiation. And I don't know if Dr. Stein was leaning that way either, but she asked about radiation, so I thought I'd rather hear from the radiology person. So that was an interesting kind of weight things towards chemo because Dr. Mavori said that. I've also been having these sort of eye issues, like temporary partial blindness and blurriness and pressure, and I still have these tender spots around the head. I reached out to my eye doctor, who I was shocked to find was not helpful in terms of seeing me soon because I was having worrying eye changes. I reached out to my APRN saying, hey, maybe I need a referral to an eye doctor because I'd rather not wait until April when I do have an appointment. I haven't heard back on that. I just checked before I hit record. So if you have an eye doctor that you can recommend, nearby, this is the first issue I've had with Dr. Bowen's office in Brantford, who I think is spectacularly amazing, and as well Seth Meskin, her colleague, but they couldn't give me any doctor any sooner than my appointment with her in April, I think April. And I was like, but I'm having like an eye thing, like what? And it was basically, well, we'll see in April. So anyway, that's another thing. If you go to linktr.ee, Linktree, linktr dot, ee. So the tree is broken up by the period. Linktree / Someday Farm. You'll find all my links, including my GoFundMe. I imagine I'm going to be super buried in bills yet again, and I'm not out from the previous bills. Okay, I don't know if I have it in me to fight to try and stay where I am. I gave up one home. I'm doing my best to make this a home for us. Okay. Big thanks to Dr. Bear for taking care of Barely Bear, and for Barely Bear for taking care of me. Sarah's due for surgery too. We don't have a date yet, but I suppose it's possible we're both laid up at the same time, and I'll do my best to teach, and I'm sure you'll do your best to be flexible and attend the classes you can attend. But we may be needing, the two of us, more help for a week or so if it works out that we're both laid up at the same time. And I'm guessing I'll probably definitely need some rides to chemotherapy or advice on getting a new medical oncologist or eye doctor. Okay, thanks for that long one. I'm gonna just sit for a minute and begin a bit of the processing. Love. Thank you.